California is a garden of Eden, a paradise to live in or see. But believe it or not, you won't find it so hot if you ain't got the do-re-mi.
So what we'd like to do is engage all of you. We have a microphone set up. Let's really pick the brains of these three folks who have come here this evening.
How will the reimbursement rates be structured for a single payer? Will it be equivalent to a Medi-Cal, Medicare, or Blue Cross?
In the bill that's been out there for a number of years, currently SB 810, formerly SB 840, all of that, basically it sets up a commission to determine reimbursement rates with the specific mission of making sure that those reimbursement rates are adequate to provide a good pool of payers, a good pool of providers, excuse me. It doesn't peg them to any other program. One point I will make is that Medi-Cal, in particular, Medicaid in other states, is in general a very poor program. And the biggest reason that it's a poor program is because it, in general, serves an impoverished population. It serves people who the legislators tend to view as powerless, and consequently, it tends to be a poor quality program. Whenever we put programs in place that serve groups of people who have less influence, those programs tend to get second-rate quality in every kind of way. We think that's one of the advantages of a program that provides a single standard of care to everybody, is that you then, when you have people who have a greater level of power and influence and a greater level of voice being served by the same program, the program tends to operate more effectively and not to create some of these artificial barriers.
Seems like a lot of the health costs are increased by insurance carriers themselves. Will that also be the case with this type of care?
Basically, again, it does not micromanage physicians in what they can prescribe. I tend to be, partly because I've traveled there some and even had the occasion to use their healthcare system. The French system is one that I look at with particular interest. When they were initiating their system in France, basically there was really a deal between the government and the doctors. And the deal was that the doctors would accept this universal system and not push back against that, and perhaps accept slightly lower reimbursement rates than what they could have gotten in other circumstances. And the return was that the government does not micromanage at all what they can prescribe. I think that's an optimal kind of system. That system gets the best results of any system around, and because it leaves doctors free to make those decisions. Right now, we have the insurance companies really meddling in every little detail, and the proposal, again, this is just a proposal, but the proposal that's out there under SB 810 would actually leave doctors much freer to do what they want to do and what they need to do for their patients than the current insurance companies do.
Hi, my name is Matthew, and I'm terrified of public speaking.
You're my friends now.
No, come on. To what extent does the healthcare plan provide coverage? Like, for example, if someone was on life support in a hospital, who determines how long that person remains on life support, or is that person supported by the healthcare plan indefinitely on life support?
Their doctor, and basically it wouldn't change anything in that regard. It does not create death penalties or anything like that.
My grandma is a pretty starch Republican, and she's she's totally against the healthcare reform, and ironically enough, she's on Medi-Cal. So I get into debates with her. And I was wondering, what points would you focus on when talking to people who are not for the single-payer system?
This is your chance, panel. What do you actually say?
Well, I think one of the things that is important to emphasize is that Medicare and Medi-Cal have much lower administrative costs than private health insurance. In terms of how much percentage of each healthcare dollar actually goes to patient care, in those government-sponsored programs, it's actually much higher than what you see with insurance, private insurance, because you're not paying big salaries to CEOs.
Anybody else? What do you say to Grandma?
Every other industrialized country in the world has some version of a universal healthcare system. They vary a lot by how they're run. They're very different, but they have certain things in common. None of them have a major central role for for-profit health insurance. All of them cost about half as much as what we spend, and all of them get results at least as good as we get. And I just refuse to believe that America is uniquely unable to do this. It just seems like we ought to be able to accomplish what other countries have shown us how to accomplish. It shouldn't be impossible for us to do.
We're working on getting the word out there. Now I know that someday we will have universal health care in the United States. We will have Medicare for all. And it may happen when I'm dead and gone, but it will happen.
California is a garden of Eden, a paradise to live in or see. But believe it or not, you won't find it so hot if you ain't got the do-re-mi.